Cassandra Wanzo, MD, is a psychiatrist based in Atlanta, Georgia. Dr. Wanzo's office provides quality psychiatry services that are designed to not only improve mental health, but also overall well being. She is a highly experienced and respected psychiatrist serving the Atlanta, Georgia area for over 20 years. She has been frequently quoted as an expert source for various noteworthy publications. Her list of credentials and awards is extensive and can be found on her website. She is a devoted member of Alpha Kappa Alpha Sorority Incorporated. All right, Dr. Wanzo, are you ready? Where are you?
Yes,
We're gonna
I
do this.
am.
We're
Yes, I
gonna do
am.
this thing. We're gonna do it together. You ready?
I'm ready.
All right, and greetings to you. It's good to see you. I'm gonna a little different from the other presenters. I'm gonna be kind of interviewing you and just asking you a few critical questions. And as I've been listening to the other presenters, some of what they've said kind of are embedded in the questions that you and I are going to talk about. So just we'll just start off, and we may not be able to hit all the questions because I think I sent you about 15 or so. So we'll hit the ones that I think come to mind at the time. All right, so let's see here. In your practice as a psychiatrist, what do you find are the top 3 reasons your female patients come to see you?
Well, what I want to say is like really the top two, which are predominantly the reasons people come, are anxiety and depression, especially since the pandemic. The rise in anxiety and depression has just skyrocketed. I have never been busier in my practice than I am now. People are
Wow.
truly suffering.
Wow. Okay. Okay.
Mhm.
Okay. Okay. All right. So anxiety and
And
depression,
depression,
top two, and
right?
depression. Got you.
That's the majority of what I see. Anxiety, people who are suffering from anxiety and depression. And I can say, and the numbers have just increased
Mm.
since the pandemic.
Since the pandemic.
Yeah.
Okay, got you. Got you. What would you say? This was not one of the questions
Mhm.
that I sent, but it kind of spins off of what you just said.
Mhm.
What would you say is the reason you think that the pandemic plays such an important role in the increased numbers of people who are dealing with anxiety and depression, either initially, like for the first time, or it's gotten worse? What was it about the pandemic that you say had an impact on anxiety and depression?
Well, one big factor is the isolation with the pandemic. You know, we're isolated from family, friends, co-worker, and by nature, we are social beings. So the
Right.
isolation has played a big factor in the anxiety and depression, being isolated from others, because as I said, naturally, we're social beings. We're created by God that way. So the isolation,
Absolutely, absolutely,
yeah. Mhm.
absolutely. Okay, good, 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 good.
Mhm.
Another question for you. And this kind of ties back into some things that I've been reading in the chat and just some other things that we've heard this morning. Question: we've probably all heard that mental illness can be hereditary. Is that true? And what would you
Yeah.
want us to
Oh,
know about mental illness and heredity?
yes.
So what
Mental
would you want us to know about
Okay.
that?
Well, mental disorders do run in families, which means that there is a genetic predisposition to many of the mental health disorders. We haven't quite worked out the genetics, but we do know that it exists. Like, for instance, one of the highest genetic predispositions is in addiction. Drug addiction is like a 50% chance if you have like a parent who has a drug addiction that you will also um, experience that. So it's important for people who have such histories to talk to their children, early on about preventing that same path themselves. Some of the other disorders that have a genetic predisposition are major depressive disorder, bipolar disorder, attention deficit disorder, schizophrenia,
Wow.
anxiety disorders, and substance abuse problems. Those all have a genetic component, a genetic predisposition.
Okay. So does it matter if it was the father or the mother necessarily, or
Father,
doesn't
mother,
matter.
relative, but yes, it doesn't matter. It's there.
Okay,
Yeah.
I hear you. Okay, got you, got you, got you, got you. All right, another question for you. As women, what would you tell us about ways to encourage the men in our lives to go and get some mental health care, see a therapist? How do we do that? Because we know historically, probably a little bit,
Mhm.
maybe it's gotten a little bit better, I feel, but we know historically men have been a little resistant when it comes to even really thinking about their mental health and seeing a therapist was like, no way. So as women, what can we do? What would you recommend that we do to help the men in our lives to take care of themselves in terms of mental wellness?
You're right. In this society, men are conditioned to not express their feelings, to not cry, and those things are kind of conditioned out of them. So they see it as a sign of weakness, seeking help. So as the partner, spouse, what you can do is first tell them that you recognize that they're going through some things, that they're suffering. Let them know that you care about them, that you love them, and you want the best for them. And the best would be is getting help, just like if they had a broken ankle or something else, there's no difference. So to encourage them to get help for whatever they're dealing with emotionally, but in an atmosphere of love and support.
Absolutely, absolutely, absolutely. Okay, women, you heard it right here. Whether it's your husband, brother, uncle, whoever it is, encourage them, that it's not a sign of weakness
Mhm.
to have their mental health taken care of. Let's see, what are some behaviors that we might not put in a mental health category, but come under a mental health category? Like stealing or addictions or habitual lying or whatever. Talk to us about those things that we don't necessarily, we know of people who have those issues, but tell us, is that a mental, like some things
Okay.
we put under the mental health
Mhm.
category that don't necessarily belong there. And there's some things that we haven't put under a mental health category and these things
Okay.
do belong there. So can you speak to that?
Okay. Well, you mentioned stealing. So you do have like the people who shoplift, that's not a mental health issue, but there is something called
Mm,
kleptomania, where people
mhm,
steal objects not because they need them or they want them. They're often items of insignificance because it's a type of compulsive behavior that they're driven to do. I'm from Wisconsin, and we had this well-known
mm.
politician who was often arrested for, like, all the restaurants, she would steal the knives, the forks, and things like that in her purse. Right. And it was a compulsive behavior. It wasn't. So that's a type of mental disorder.
Oh,
That's kleptomania. So it's not things of value or the shoplifting, it's a compulsive behavior. So in stealing in that case is a compulsion.
gotcha.
Also, there's
Gotcha.
pathological lying that people do, which can often be a sign of a severe personality disorder like narcissistic personality disorder, antisocial personality disorder. Behaviors such as hoarding. I know you've seen the show Hoarders.
Mhm.
Most of you have seen the show Hoarders. Now, hoarding is a mental disorder, is as classified under DSM-5, and that's where people accumulate all kinds of objects that are insignificant, to the point, like, I work at a clinic during the week, and we have had some patients, if you go in their home, because we do home visits, it's in this kind of group, it's called assertive community treatment. We do home visits, and you'll walk in, and the house is completely covered from floor to ceiling and all kinds of things,
Wow.
countertops, sinks, beds, and often there's only a narrow pathway that you can get to maybe to their bed. It also applies to animals. We had one patient who had 17 cats. The smell of the feces, the urine, I mean, it was unsanitary. So we had to call animal control to come in to remove the cats. And she was emotionally devastated because to her, these were her children. And she was just devastated when we had to remove those. So for the hoarder, I mean, other people may see what they collect as junk, but to the hoarder, the objects have significant emotional value to them. And that's why it's hard for them to part with it. So hoarding is a kind of behavior that is a mental disorder that we may not often think about. So those are some. Mhm.
And that those
Mhm,
are all good. Let me just do a spin off on the hoarding. Okay,
mhm.
so when do we know when just collecting some great things and you just have a lot of them, when does it go from that into hoarding? You know what
Okay.
I mean?
Mhm.
Yeah.
Well, you can collect things and they don't disrupt your normal activity. What hoarding does, because you've blocked out, I mean, there's one patient who her house was so full that she couldn't get to the bathroom because the path was
Mhm.
blocked. And she actually urinated in containers because she couldn't get to the bathroom. So that's dysfunctional
Wow.
and it's blocking off your normal functioning.
Absolutely. Absolutely. Yeah, that's a pretty clear
Mhm,
line of distinction
mhm,
there. So I hear you. I hear you. I hear you. Another question for you. Tell us about your work dealing with childhood trauma among women.
You're right, a significant number of African American women experience that. I used to be the psychiatric consultant for the Job Corps here in Atlanta till they closed, and 99% of the young women who presented there presented with trauma. So as a psychiatrist, I prescribed meds as necessary, but we had a psychologist who provided therapy. Now in my own practice, I'm only in my office on Saturdays, so I tend to, provide medications, but then I refer them to therapists who do the trauma-based psychotherapy. I don't know if Dr.
Mm.
Kamala does that kind of therapy, but I refer them to the therapist
She
for,
said yes.
okay, that's why I tend to refer them to the trauma-based therapist. But often they'll use cognitive behavioral therapy where you address their faulty thinking patterns and change their behavior patterns.
Understand, understand. Okay, let me jump over because I want to get in as many questions as I can while we have you here. Talked about medication, and we've heard medication mentioned, I think, from all of our previous presenters. Speak to us about medication. Um, when at what point would you say, you said you've been seeing people with anxiety and depression, at
Yes.
what point would you say, well, okay, you need to see, a therapist, and exercise? But then at what point do you say, but we also need to couple that with some medication?
Okay.
So how do you differentiate, or how do you progress
Mhm.
along that continuum as to what people should do in terms of treatment?
Okay. So for the diagnosis of major depression, because we all have our normal ups and downs and fluctuations in mood every day on a daily basis. But in order to have the clinical diagnosis of depression, you have to have the symptoms daily for at least 2 weeks to make that diagnosis. And the symptoms would be,
Mm,
like either
gotcha.
sleeping not enough or too much, eating too much or not enough, um, loss of energy, loss of motivation to do things, loss of interest in things that you used to do, shortened fuse, like snapping on people, being irritable, impaired concentration. And one of the key signs is helplessness, hopelessness, and thoughts of wanting to die, suicide. If anyone is expressing any kind of suicidal thoughts, please take them seriously because they're often missed. People say, well, if they talk about it, they're not going to kill themselves. That's not true. Black people don't kill themselves.
Mm,
That's not true. So if anyone is
okay.
talking about wanting to die, kill themselves immediately, they need help. And that's a time that they need medication. If they're impaired in the ability to function in the relationships at work because of depression or anxiety, then medication is needed. If someone is having extreme mood swings, highs and lows, in a bipolar
Mm.
manic episode or a bipolar depression, that's a time for medication. So,
You hit on something when you mentioned, first of all, thank you for that answer. When you
mhm.
mentioned about suicide, so sometimes well, let me ask, do you feel that sometimes we miss the suicide message because we're looking for it in a certain way? Meaning, if the person doesn't say, I'm going to kill myself, then we don't think they're going to kill themselves. But what other messages should we look for that point to suicide, but the person may not necessarily say, that's what I have on my mind?
When you look for warning signs, for instance, if someone starts to give away possessions, expensive possessions to people, that's a sign, that's a warning sign if they're giving away their possessions.
Mm,
Um,
okay.
if someone, well, I mean, we all should have like a will, but if they start making plans, like making a will or things like that, just just, look out for that. If they talk about, that they're burdened, like if someone like, particularly people with chronic illnesses will often say that they feel like they're burdened to others. So that's a warning sign if someone's feeling like they're burdened, and people would be better off with them. So the statements that people make, pay attention to what people are saying and what people are doing. Or like erratic behaviors, like someone might start driving, really fast, that can be a warning sign, like some kind of, erratic behavior like that, driving fast.
Got you. Because I think sometimes I've just, just in hearing about people, from family members or other, just in the community of people who committed suicide, they never said, like verbalized that was what they were thinking about doing, but they may have verbalized it in some other way. I mean, just with their mouth. Yes, there are actions, like you said, that may point to it, but other phrases, like the world would be better without me, something, you know what I mean? Those kinds of things that we need to also look out for. I'm with you. I'm hearing you. Okay, let me just see another question here. As a psychiatrist, how do you combine your faith with your practice, if you're able to do that at all?
Oh, yes. Growing up, my father was a pastor of a church for 50 years. So I grew up in the church. And one of the reasons that I wanted to go into the mental health field, because I saw how he helped his people with pastoral counseling. And he was kind of like my role model. And I always looked up to him. Wow. And that's one of the reasons I went into psychiatry. So how I use my faith, whenever I'm seeing a new patient, I pray. I ask for guidance. Help me to make the right diagnosis. Help me to choose the right treatment that's going to help this person. And then I pray for healing. So I do that with all my patients. They may not know it, but that's part of what I do.
That is wonderful. That is wonderful. That is wonderful. That is wonderful. I want to jump to the chat and just ask a couple of questions too. Someone says, could you ask Dr. Wanzo to discuss her foundation that offers mental health care to the homeless population, where you have, I guess that's a part of your practice?
Okay, so I'm director of a program. It's called Assertive Community Treatment. That's what I do during the week. I do my practice on Saturdays, and during the week, in assertive community treatment, we work with the patients who are called the hard to reach, the patients who would not normally come into the office. These are the people who you can find, pushing a buggy on the side of the road, or people who've been homeless. We often get referrals from the jail or from mental, from the inpatient hospitals. So these people typically have a diagnosis of schizophrenia. Our organization, we get funding, and we provide housing for them. We get housing vouchers and find apartments for them, so we provide housing. We have counselors on board that help them get their food stamps, get the government-sponsored phones, get half-fare MARTA cards. We have a vocational specialist who helps them if they want to work, to find jobs, and we have some of them who do work, like at McDonald's or at the airport or Starbucks, things like that. We have a nurse who administers injections, because most of the patients, because they don't want to take meds, we give them injections of psychotropic medicines that they take once a month, and they have some that are every 3 months, and now we have one that's every 6 months. And we go out to their homes, like, well, since the pandemic, we've had to cut back on that. But myself as a psychiatrist and the nurse, once a month, we would go out to the homes, see where they live, and assess them, in their home conditions. The nurse currently goes out to their homes to see where they live. All the other case managers see them in their homes. They're seen 3 times a week by a case manager, one who may specialize in housing. We also have a substance abuse counselor, the ones that help with vocational issues. So it's a comprehensive team. It's called Assertive Community Treatment.
What a wonderful service for that area. And hopefully there's something like that in the DMV where I am.
Hopefully every area should have that. Look for Assertive Community Treatment. It's called Assertive Community Treatment. an ACT team, so we call
Okay, okay.
Mhm.
All right. Could somebody please, Phyllis, if you could put that in the chat, that'll be wonderful. Let's see, someone asked a question, another question. Wait, where was it? Let's see, hold on. I think it was the question about the difference between suicidal ideation and suicidal thoughts. Ask about the difference between suicidal ideation and suicidal thoughts, if there is a difference.
They're both saying the same thing, thoughts of wanting to die. It's really, a different way of phrasing it. It's the same, suicidal thoughts and
I
ideas.
got you.
Yeah.
Okay, I'm with you. I'm with you. This is a great question,
Mhm.
and one that I was going to ask you. This is from the chat from Carolyn Winbush. She says, how do mental health care providers not lose their own minds when they take on so much negative energy every day?
Well, I want to harken back to what Dr. Kamala said in terms of self-care. That is really, really important. So for me, I do things like manicure, pedicure, massages. In fact, I have a standing massage every 2 weeks. So that's very important for me, self-care.
I know that's right. Oh my gosh. I am so overdue on all of those things. Okay. All right. So let's see. So self-care
Yes.
is how you manage that.
Mhm.
This is, can you please ask Dr. Wanzo if the anger, road rage, and ask her about anger, road rage, and mass killings. What is contributing to this? Is it mental health, societal problems, or both? Is there anything we can do broadly to stop some of this?
Wow.
That was kind of a loaded question. It's got a
Yeah,
lot of things in there, so you
a
can
lot.
just pick one.
Well, I mean, in our culture, society, violence tends to be glamorized in, TV, media, video games. So I think as a whole, in society, we tend to glamorize violence and guns and things like that. So I think a lot of it is a societal, social issue where, we do tend to glamorize those things. But then on an individual basis, you do have those people who are angry, frustrated, like in some of the school shootings. They're loners, they've been bullied, so they act out their anger and rage, and it's a chance to get attention, to get back at others. So there are individual factors that lead to that based on individuals who've been bullied and feel like, they're angry and they need to, to take that out on others.
On others, understand. Another question for you. Well, let's see. Let me go back. What is the best, this is from the chat, what is the best approach to help someone realize that they need therapy? We recognize there's a problem, but unfortunately the person has not come to that realization. How best to help a pathological liar is one of the questions.
Wow, that's a difficult, because if they don't recognize that this issue, then they won't get treatment. As certain people like political figures who fall into that category, they don't think that they have that problem. It's really hard to get them to get treatments, like a narcissistic personality disorder, because they are so narcissistic, they think it's everybody else, that they have no issues. But in general, other people, like I mentioned with the men, just out of support and caring that you love them, you want the best for them, and you can see that they may be suffering, and you want them to have a better life and to seek treatment.
Understand. Let me see. How do we? Oh, wow. Yeah. Carolyn Winbush says, how do we help people who are cutters, especially young people?
Wow. That's often, like when people cut, you may think it's because they want to kill themselves. It's called self-mutilation. It's a behavioral thing. And often when they cut themselves, it's a sign of releasing tension when they cut themselves. And that's often found in people who have the diagnosis of borderline personality disorder. When I worked in a women's jail, I mean, that was so common, to see people who are cutting, but they require, intensive treatment, cognitive behavioral therapy, medication. So it's a multifaceted approach for them. But that's a sign of them. They feel relief when they cut and see the blood. So that's, in that case, they're not trying to kill themselves, but it's a sense of emotional release to see the blood coming out.
Wow. My God, my God, my God. I'm gonna take one more question. Let's see. Rosalind said, this is so powerful. Dr. Wanzo, so many people on the street are there because of mental health issues, going back to what you do in terms of your work with the homeless. Thank God how passionate and sincere you are about helping your patients. Let's see. I think I'm gonna stop there. Definitely, Dr. Wanzo, look in the chat, see what else is going on by way of all the questions that people have for you. Let's see, how do people, outstanding information. Thank you so much, is what one sister said in the chat. I'm going to agree with her. On that note, I'm going to say thank you so much for being with us.
I want to add,
keep hanging out with us if you can.
I want to add one thing to what Sister Ronette said.
Absolutely.
She said, it's okay to not be okay. And what I'd like to add to that, it's okay to not be okay, but it's not okay to stay there.
Come on.
Okay.
I'm with you. I'm with you. It's okay to not be okay, but it's not okay
to stay there.
To stay there. Right. Okay. Let's put that on a t-shirt, somebody. I love it. I love it. Put one part on the front and the next part on the back. I'm with you in total agreement. And I'm just so thankful that as Ronette was sharing and realizing what was going on in her life, that she took those steps to take care of things, and that she had such a loving support system. So it's okay to not be okay, but it's not okay to stay there. All right. I think we're all in agreement with that. Thank you so much. Let's give Dr. Wanzo some love in the chat, and we are going to move right along. Thank you.